Module 5, Lecture 2, Cardiac Tamponade and Cardiogenic Shock. We're going to define cardiac tamponade, identify the signs and symptoms of cardiac tamponade. We're going to also explain Beck's triad when assessing a patient experiencing cardiac tamponade. We're going to discuss the treatment for cardiac tamponade, and we're going to define cardiogenic shock, identify the signs and symptoms of cardiogenic shock, and discuss the treatment for cardiogenic shock. So, cardiac tamponade. This occurs when excessive fluid accumulates within the pericardium. So this limits the heart's ability to fully expand, and we remember that the myocardial tissue needs to fully expand so that it can contract strong. That's the Frank-Starling mechanism. If not treated, cardiac filling reduces enough to stop blood circulation. It can result from tumors, pericarditis, chest trauma, or in some rare cases, MI. With cardiac tamponade, the ECG is of limited value, but it may show electrical alternans and pulsus alternans. Electrical alternans is an electrocardiographic phenomenon of alternation of QRS complex amplitude or axis between beats and possible wandering baseline. Pulsus alternans is a cardiovascular phenomenon characterized by alternating strong and weak pulse pressures during a sinus rhythm. And pulsus paradoxus is defined as a fall of systolic blood pressure of greater than 10 millimeters of mercury during the inspiratory phase. So one of the things that you're going to look for with cardiac tamponade is Beck's triad. So Beck's triad is going to be composed of three things. You're going to look for hypotension because you've got decreased cardiac output because the heart's not able to pump. You're going to look for jugular venous distension because blood is backing up because it's not able to pump out. And then you're going to also listen for muffled heart tones because now you're listening through fluid as you're trying to listen to the heart sound. The management for cardiac tamponade is nothing that we can do really in the pre-hospital setting because a pericardiocentesis is what's needed. So this is where they'll actually insert a needle into the pericardial sac and draw fluid out, which will allow for the heart to be able to contract better, but it's not allowed by paramedic. Cardiogenic shock, also known as pump failure. So this is one of the reasons why you must continue CPR for 2 minutes, even if you get ROSC, because the heart's going to be in pump failure. This occurs when the heart cannot pump sufficient blood volume to maintain tissue perfusion. It may occur after resuscitation, and it usually occurs when at least 40% of the left ventricle has been infarcted. Symptoms include difficulty breathing, extreme fatigue, and general malaise. Signs or symptoms like other shock types, which include confusion or the patient may be comatose, restless and anxious, rapid and shallow respirations, racing and thready pulse. The blood pressure falls to less than 90 millimeters of mercury systolic, which may be higher with pre-existing hypertension. But one of the key signs that you see with any type of shock is going to be hypotension. The goal is to treat before the shock becomes irreversible. Improve oxygenation and peripheral perfusion without adding work for the heart. Secure the airway and administer 100% oxygen. Place a patient in a supine position if they can tolerate it. If they are experiencing pulmonary edema, place them in a semi-Fowler's position. Start an IV line at a keep open rate. Physician may order a trial of fluids. Rapidly infuse 100 to 200 milliliters of saline to see if that improves the hypotension. We want to monitor the pulse, the blood pressure, and the level of consciousness, and obtain a 12-lead ECG. So one question, why is a big fluid bolus contraindicated? And that's simply for the fact that the pump is failing. So if you've got a failed pump, you don't want to add any more fluid to it than's necessary in order to keep it from continuing to fail. So with cardiogenic shock, the main management is going to be something that includes a drug that improves inotropy and possibly chronotropy as well. So you've got dopamine, norepinephrine, or epinephrine. Dopamine maintains renal perfusion the best, but it requires careful titration and frequent monitoring. Across the board, a patient in cardiogenic shock should be transported immediately to a hospital.